All right. By a show of hands, how many of you could understand my mood? None of you, right? Today, I said, today I'm excited. You really couldn't tell from my expression, right? Even without knowing the language, many people can still tell how a person feels by their facial expressions. And nowhere is such a practice more evident than in deaf culture. The use of facial expression is necessary in communicating and is regarded as a cultural value within the deaf society. Facial expression is crucial within communicating. My deaf sign language teacher constantly talks about how important it is for us to use facial expressions when we're signing, because her, as being a deaf individual, constantly tells us that our facial expressions do not match our signs, and so it is difficult for her to understand us. There are certain words within the deaf vocabulary that rely on facial expressions, such as WH words like who, what, where, why, and how. When deaf individuals ask each other questions, they furrow their eyebrows. Whereas in hearing culture, we just change the pitch of our voice. So that's how you can tell with in sign how when you're talking with another person. Along with necessity, the use of facial expression in sign language is regarded as a cultural value. When deaf people communicate with each other, they are very straightforward with their emotions. And this is seen as common and even respectful. To be dishonest with one's emotions is unheard of and unpracticed. For example, when a person is going to talk about their, say, step parent, the step parent will automatically know how that person feels about them based on which sign they choose. So, for example, the sign for stepmother is this, as well as this. The first one meaning I think of her as my own stepmother, as my own mother. The second one meaning I really don't like her. So it's very clear within deaf culture how one feels about another person through their facial expression and their sign. Facial expression is necessary and is placed as a cultural value in communicating within the deaf community. To them, expression is like breathing air. It is necessary and it's always there. So if you ever get to meet a deaf person on the street, just remember that expression is key. Thank you. Okay, who's gonna go next?
That was great. I'll go next and get it over with.
Okay.
All right. If I pop back on here. It doesn't seem to want to get rid of you, Samantha. There we go. All right. All right. An apple a day keeps the doctor away. This old adage is more accurate than you might have imagined. When we hear the word diet, we tend to think of weight loss and not about health. However, small changes in diet can have important effects on your health. As a pastry chef at a country club whose membership average age is in the 70s, I tend to cater to a lot of nutritional needs, diabetic friendly being the most common. And over the years, it's really sparked an interest in nutrition in me. A few rather simple changes to your diet, such as lowering the intake of sodium and sugar and eating the right kinds of carbohydrates, can have tremendous effects to benefit your health. Americans on average consume 3,400 milligrams of sodium a day. The RDA is 2,300 milligrams. Too much sodium increases the risk of stroke, kidney disease, heart failure, and more. And it's estimated that if the US population were to decrease their daily intake of sodium to just 1,500 milligrams a day, it could result in about $26 billion in healthcare savings and save the lives of 500,000 to 1 million people over 10 years' time. A few simple tricks to lower sodium intake are to read food labels. Even processed foods that don't taste salty can have a surprising amount of sodium in them. Buy fresh, not processed meats and vegetables, which are high in sodium from the preservatives used, and rinsed canned products like beans and tuna fish. Salt preference is an acquired taste, and after a few weeks, you won't miss it as much anymore, and those sodium-packed foods won't be as appetizing as they used to be. Much like sodium, we are also getting way too much sugar in our diets. The American Heart Association recommends 24 to 36 grams of added sugar a day. However, the average American consumes 82 grams. Sugar is a huge contributor to the obesity epidemic in the country, causes insulin resistance, which can lead to metabolic syndrome and diabetes. It overloads the liver, and evidence has even linked sugar to elevated insulin levels that can contribute to cancer. Just like with salt, sugar preference is also learned and can be unlearned with a little bit of effort. Cut sugar intake by learning the different names for sugar, like corn syrup, evaporated cane juice, sorghum, glucose, and really most ingredients that end in ose. Buy unsweetened and no sugar added foods. Stop drinking soda and those other sugar-packed drinks like enhanced water, bottled teas, and energy drinks, because 47% of the added sugars we consume come from our beverages. Added sugars are among the bad carbohydrates that Americans are eating way too much of. Your body is fueled by carbohydrates, and there are two types: simple carbs, such as those added sugars, and complex. Too many carbohydrates can contribute to diabetes, cardiovascular disease, and obesity. Limit simple carbohydrates in your diet, such as sugary cereals, cookies, candy, whole milk, and products made with white flour. And eat more complex carbs, like fruits, vegetables, skim or low-fat milk, and products made with whole wheat flour. Making some of these minor adjustments to your diet, such as cutting down on the sodium and sugar, and eating more complex and less simple carbohydrates, can have beneficial effects to your health and quality of life now and in the long run. This, along with exercise, can even prevent some diseases such as diabetes and heart disease. As the Greek physician Hippocrates said, "Let food be thy medicine, and medicine be thy food." Think about what you eat and how it benefits or damages your body.
All right, good job. Okay, I would like to go next. Okay. I'm gonna beat the chair. Hi everyone, I'm Mia. Can you guess what I have in common with the ancient Egyptians of 500 BCE? We are both skilled relief printers. Tonight I'm going to introduce to you the ancient art form of relief printing, show you the materials used to make relief prints and how easy it is to make a relief print. All you need is basic art supplies or even food and tools found in your kitchen. You might be wondering, can learning this benefit me? Maybe you've been invited to a party or a baby shower and you want to give a personal and unique homemade gift. This is where relief printing comes in handy. I first became interested in relief printing when I took Printmaking 1 last year. My teacher was accepted to the graduate program for printmaking at Yale, and she is very talented. This year, I'm in Printmaking 2, and I have used rubber, linoleum, and wood to make relief prints. I am also in AP Art History, where my teacher earned her master's degree in art history, and she has taught me all about the history of relief printing, and now I'm going to teach you. The ancient Egyptians, always trying to be attractive, wanted designs on their fabrics. Back then, they used wood and stone carving tools. It quickly spread around the world and eventually became a criticized art form because, unlike paintings and sculptures, which are one of a kind and can never be recreated exactly, relief prints can be printed hundreds of times to create identical prints. Now that we've looked at the history of relief printing, let's look at some of the basic materials used to create them. All you need is some rubber, a carving tool, paint, ink, or dye, a roller, and all of those materials can be found at Michael's Art Supply. You will also need some plexiglass or any hard flat surface. If you don't have any of these items, don't worry. All you need is a potato, some paint found in your garage, a potato peeler, or even a screwdriver. Now that we've looked at some of the materials used to make relief prints, let's make some. Okay, so first, you can take a little bit of paint and put it onto the flat surface that you've chosen. I'm using cardboard. All right, you don't need too much paint. Just a little amount is fine. Then you take your roller and you roll out the paint until it's evenly distributed onto the roller. All right, and once it's evenly distributed, you can transfer it onto your stamp. All right, I'm going to be using a baby's onesie to show that it's perfect for gifts. So then you take your stamp and you put it onto the surface that you're going to print onto and apply some pressure. And make sure it doesn't smudge or anything, because then your image will come out blurry. All right, and then you gently take it off. And there's a little lobster I made. Okay. And to actually make a relief print, I'm going to demonstrate on the potato. First, you have to cut it, which I did beforehand just to save time. And I'll be using a potato peeler. It's always important to carve away from you so you don't stab yourself. And all the space that you cut out is the negative space, so that's not going to hold the ink. And I'm just going to carve some lines just to show different things you can do. All right, and then you apply the ink the same exact way. Put it onto your roller, and then put it onto your potato. Get a little bit more paint. All right, I'm going to use paper for this one. And you put it onto the paper or whatever surface you're using. Push down. All right, this is a quick demonstration. My potato isn't very flat, but with more work, you can get a pretty cool stamp. All right, so now I'm going to show you some of the past prints I have made from my classes. This is a lifeline I made, and this one was made out of linoleum, which is a harder surface than rubber. And this is actually the first print I ever made. It's a little tiki head and a turtle, and the good thing about rubber is that you can print on both sides of it, so you can reuse it. All right, now let's recap what we've learned. Relief printing was developed by the ancient Egyptians in 500 BCE. It quickly became a criticized art form because it can be replicated many times. You can use materials found in your kitchen and garage, and it's easy enough for anyone to do. I hope you enjoyed learning about the ancient art of relief printing. Next time you are looking in a store through all the patterned clothing, remember you have the ancient Egyptians to thank. And remember, all you need is a potato, a basic tool from the kitchen, and a basic tool from the kitchen to create your own relief print. Okay, thank you.
I don't think I can do that one, Mia.
That was awesome.
Thank you.
I don't want to hide my face. Can you guys see it? Okay. Okay. My topic is called anemia. Anemia because basically it speaks of myself, of my health condition that I have. I decided to present about anemia. The funny thing is today I was actually having the symptoms where all over my life. The first thing is, what is anemia? Anemia is a medical condition where your healthy red blood cells dip below normal limits. At the time, the people that are affected are women that is of childbearing age. Being the fact that I have children, I can actually explain that to you very great detail. The first time that I actually experienced anemia was when I was pregnant with my son. After I had him, the amount of blood that I actually lost, normal blood level is considered to be at an 11. I was at a 3. Doctors were in shock. All I know is that within minutes, I was being rushed down the hallway after I had him, and immediately I had to receive a blood transfusion. They were stating that they were surprised that I actually ended up living, which I'm very thankful for today. So I will explain to you in greater details the symptoms of anemia and ways to cure it, because anemia is very serious. It's borderline close to being sickle cell. Anemia, here is basically some symptoms of anemia, and it shows the different ways that anemia can affect you. Right here, as far as your central nervous system, it can cause fatigue, which is what I was feeling today, as well as dizziness. There are times when you can be upbeat, moving around in the middle of chores, completing a task, and in the middle of whatever you're doing, of your daily task, you would have to stop, take a break. You may have to lay down for, it depends on the time frame as to how extent your anemia is. With that being said, you can also have different rapid heart rate. There are times when I've actually felt that, where I am just sitting doing homework and I will sometimes receive a shooting pain, but my heartbeat starts to accelerate and I have to sit, take a glass of water and just relax. It takes for me, I can speak for myself, but it takes for me approximately 5 minutes before my heart rate basically decelerates and basically returns to normal, what it was before. Also, you have other symptoms where it shows you have chest pain. If anemia gets out of hand, or how can I say, if you do not try to maintain it, it can also lead to signs of a heart attack. The worst part that I felt actually dealing with anemia, which actually causes severe headaches, as well as you do get shooting tension pain in your eye area. With the headaches, which you can also, if you are once again, as I say, high risk, you can have with high risk anemia, you tend to have migraines, which is for myself. Migraines can last at a minimum, for me, 2 weeks, or at the most, it can last up to a month. It just depends on, like I said, the episode that you're currently having. With anemia, you also can feel shortness of breath, as I stated, lightheaded, dizziness, and fatigue. Now, the great thing about anemia, there are ways that you can actually treat anemia. You cannot cure anemia, but you can basically treat anemia by taking B12, which is iron pills. You can take iron pills maybe once a day. Depending on the nature of the anemia, you would have to take sometimes 2 pills per day, which is what I have to do. Also with anemia, there's certain foods that are great for ways to cure anemia. With anemia, the best foods that most of the doctors actually would tell you is green foods, which is one of my favorites, kale. And then the other is the baby spinach, the baby spinach, which is my favorite. I love to eat baby spinach. You can always add something to it. Some people do not like baby spinach or the kale because it's considered greens, green vegetables. You can also eat collard greens, one of my favorites. But there are other ways besides food that you can actually treat anemia as well. Another way to treat it is by exercising, eating a healthy diet. You can also do, I'm trying to think what is the other, which is the most important, which is basically maintaining 8 hours of sleep daily. If you do those 3, which is kind of difficult for me because 8 hours of sleep was the last time I actually received 8 hours of sleep. Maybe at the most for me, I can say about 4 or 5, being the fact that I work full time and then plus taking full-time courses and then having little ones. So 8 hours of sleep, nah, doesn't work for me. So if you should, maintain 8 hours of sleep on a daily basis, you eat plenty of green vegetables as well as a healthy diet, and you exercise daily, you are able to treat anemia, basically maintaining it and keeping it under control. If you do not, then you have to resort to what I had to, which is receiving a blood transfusion, and I've had a total of 3. The first was 1 bag of blood, the second was 2, and I think the last was extreme where it ended up being 4. And I had to be hospitalized for a total of 3 days. So if you do not want to get to that you follow those steps, maintaining your 8 hours of sleep, eating a healthy diet, and exercising. That is the steps and different ways of how to treat anemia and how to not get anemia. So this is anemia. Whew.
Okay, that was really good. But one thing I wanted to say was that your computer, the light was shining on, like the background light was shining too bright, so we couldn't exactly see what was on the computer. But I think that you explained it in enough detail that it was okay. That you should still be able.
Not about again. He's gonna have to accept that one.
Yeah. I mean, I think you did it with enough detail that you explained everything that was on the slide, so we could tell. It was good.
Thank you.
Welcome.
Oh, love you guys. It was awesome. Mia, you're gonna have me trying something different tonight.
I'm glad.
Drink sodas and sign language is awesome because I almost responded to you in the middle. But have a good night, ladies.
All right. Good job, everybody.
I'll send over the link.
All right.
Okay.